Hi, everybody. My name is Stephen Doherty, Dr. Doherty. I've come online to try to talk to you about getting ready for USMLE Step 1 and Step 2 CK. And I want to talk today about an issue that's, near and dear to my heart. I hear from students all the time asking me in one frame or another the question, how tricky are the USMLE questions? How do I get ready for these tricks? How are they trying to fool me? And how do I get ready for that? Listen, they're never tricky. They're never trying to fool you. Please begin your preparation and approaching questions from this simple position. USMLE questions may be hard, but they're never tricky. If you really understand what's being asked, frankly, the answer should be straightforward and easy. The problem with USMLE is you often don't understand what's being asked. A student told me many years ago, and it's still true, the problem with this exam is not what's the answer, it's what's the question. Understanding what they want you to be focusing on in the content provided, understanding what matters and what doesn't matter in that paragraph is really the art of doing well in this exam. It's not about having all the information in your head. It's about understanding what it is they want you to do with that information in question. Questions for USMLE are designed explicitly, not so you read the question and know the answer, no. So you read the question, do a mental process, and after doing that mental process, then you'll have the answer. If you're starting with the exam with the idea you should read it and know the answer, you're going to be frustrated. In fact, you're going to begin to panic because the answer is not leaping into your head. But if you understand that it's about reading, doing the process, and deriving the answer, then you'll give yourself the mental space and patience to do what you have to do. Look, this idea of taking the information and then doing a process to generate the answer is medicine. USMLE is not about you as a student demonstrating to your professor all the things you've memorized and can now regurgitate. It's about you in the context of that patient encounter being able to do the mental process, the clinical reasoning, in order to deliver the best solution to the question that's asked. It's all about giving yourself time to think. And this is, of course, true when you're dealing with questions in medical ethics. I talk to students all the time that say, I'm frustrated by these questions because I read it and I don't know the answer. Well, once again, of course not. You're not supposed to read the question or the answer. You're supposed to read the question, then do a process and get the answer. The process of medical ethics there are a set of rules or guidelines that tell you what is the best answer. If you have those mental rules and guidelines, and now the hard part, you use them on the exam, it will be clear to you what the answer has to be. The problem with medical ethics is most people use a series of bad decision rules. Most people use the idea of, I should do whatever I think is best for the patient. Well, that's actually not the case, no. Or, we have something like this in clinic, and here's what we did. Yeah, well, maybe that's not what you should have done. Just because somebody actually does it doesn't mean it's the best behavior and what you should say in the exam situation. Or, I'm an attending that told me, always do this. Well, okay, and as much as we respect and sometimes even worship our attendings, let's be real human beings. Attendings don't always get it right. There are rules that make questions correct. Your job is to learn, internalize the rules, and then answer the question based on the rules. And I tell you, if you know the rules, these questions are not hazy, fuzzy, complicated, or tricky. They are straightforward. I read a question, I go, based on this issue, here's the rule that applies, and based on that rule, here must be the answer out of the set of answer choices. The hard part is to get you to do that. The hard part is to get you to not read it and go, I don't know the answer. Let me read it again. I still don't know the answer. And now you're going nowhere, spinning your wheels. You read it, you think about what matters, you think about the rule that applies, and that gives you the answer. If you think these questions are hard, get into your preparation. Think these questions are tricky, you're in the wrong headset. You're letting paranoia get in the way of good performance. There are a set of clear rules and guidelines. What are the right behaviors and ethical legal questions. And yes, I do want to add, the rules and guidelines are for practice of medicine in the United States. I'm well aware, having been to many different countries in my life, the rules or guidelines are considered best practice in the United States, and the rules or guidelines are considered best practice in other countries may well be different. And I'm not saying the United States rules are right. I'm saying the USMLE is based on those rules. And so if you're going to get ready and do well on the USMLE exam, you better make sure you follow the rules that make the USMLE questions correct. Every question has a clear answer without really any debate if you understand the rules. And if you think the answer is fuzzy, obscure, or tricky, then you didn't do your preparation and you don't know the rules.